Hi, I'm Dr. KIMDERAMO from the American Institute of MindBody Medicine. And this is a video 3 of a series I put together to help healthcare practitioners learn how to use mind-body medicine in clinical practice. I'm a board-certified emergency medicine physician, and I also trained for decades in mind-body medicine and using this to help my patients heal, reverse disease, instead of just managing it with, interventions and medications and supplements and therapies, to actually help support the body's ability to heal itself. And if you haven't seen video 1 and video 2, definitely go back and watch those videos. I talked about some basics about what mind-body medicine is, what the main principles are, and how you can begin to integrate this into your clinical practice. I also talked about my own personal story of healing a chronic illness that doctors told me would be lifelong and that would require multiple medications in just a matter of days using this approach. And it's not a matter of using this in place of conventional medicine, but how we can implement this into conventional medicine to get dramatically enhanced results in whatever practice you're in. In this video, I want to talk about a specific mind-body modality, a mind-body tool that I've used with amazing success to help people get out of pain and fatigue and get their energy back, depression, anxiety, sometimes instantly, within minutes, and to help my patients use on themselves in between sessions to get even more enhanced results so that they were really moving forward instead of kind of continuing to come back to the same space. And before I get to that, I want to talk a little bit about the fight or flight mechanism. What is going on that's making so many people sick, how they're just living in their head, running these programs that are actually causing imbalance in their immune system, in their nervous system, in their autonomics that are limiting health tremendously. So in the fight or flight system, what happens? There's this part of your brain called the amygdala. And the amygdala sends out signals to all parts of your body. So neurotransmitters, serotonin, oxytocin, norepinephrine, all of these powerful hormones that have effects on every part of your body are controlled by what's happening in the amygdala. So it will send out a signal down to the body level that affects every cell in your body. And what controls what's going on at the amygdala? Well, most of it is subconscious firing that's keeping us in this fight or flight, all geared up and having a profound impact in diminishing health. So one of the main mind-body tools I've used has a direct impact on the activity at the amygdala. It actually calms down that fight or flight response so that if someone's, driving to work and, oh my gosh, I'm late, boom, it triggers them into a stress response that creates tension in their body. It amplifies pain, it impairs digestion, it imbalances their immune system so they're more susceptible to colds, viruses, bacteria, even things like Lyme disease that just aren't healing. If we can get people out of the fight or flight, you can have a much more powerful impact on supporting their body and healing with whatever medications or modalities you're using that maybe they were resistant to before. And so I found that this has a huge impact on everything else that we're doing medically in the body, even helping patients recover much faster from surgery. If we can turn off the fight or flight response that for a lot of people is running constantly, we can dramatically improve healing. So what happens when we're in fight or flight? Like I said, you're driving down the street, maybe somebody cuts you off and you're like flared up with anger. All of these responses are already in place. It's just that they're getting triggered by all kinds of things in the outer world. If you've treated patients with anxiety or depression, there's so many triggers that happen that keep it going, even if you use the best medications, supplements, modalities, and approaches in the world, that there's some things happening at the level of their brain. So let's just say they have their own thoughts, the ideas, the memories. Every time I think about this incident that happened when I was a kid, or every time I think about the car accident over and over, it's triggering the amygdala, it's triggering the fight or flight response. So there can be thoughts, memories, even ideas and beliefs, things that aren't even true. So our belief system BS for short. It's just a bunch of fabricated stuff that I believe about life. It's not only going to trigger the fight or flight stress response, it's also going to create changes in the brain that have me see and perceive everything differently. This directly affects health. If a patient has this belief, all men are bad, there's no good men out there, I can't trust men, it's going to trigger her fight or flight response. I got to protect myself. I'm out for myself. It'll even change the way she perceives the most kind, wonderful, loving man, and she'll have to reject that person and stay in this survival mechanism because she simply won't perceive that reality. So our belief systems have a huge impact, not only on what's happening in the autonomic nervous system, but also what's happening with our brain perception. So thoughts, ideas, beliefs, and I talked about in video 2 how our mental construct, our thoughts that we're thinking, most of them subconscious, running over and over and over, create the most profound effect on the chemical state of our body. This is one of the mechanisms by which that happens. So I want to talk a little bit about how do we address this? What can we do? And one of the most powerful mind-body modalities I found, let me just bring this page back up, is EFT meridian tapping. Now, this is a way to address the energetic system, the meridians that run throughout the body. And there is quite a lot of studies, research, clinical research, to show how these channels are connecting all parts of our body. They run along the fascial plane, the fascia, the connective tissue throughout our body. And when we use this modality, we not only affect what's happening in that sort of the beliefs and changing the way they trigger the amygdala. So now I can have that memory and not even get stressed and remember this certain thing or think a certain thought, and it doesn't affect me and put me into a panic attack or disturb my autonomics and my digestion or throw off my immune system. Those same thoughts or triggers will no longer have that physiologic impact. So definitely has a huge effect on what's happening mentally, even helping us change those beliefs and repattern our brain. One of the biggest reasons EFT meridian tapping works so well at this level is because it gets beneath the conscious mind. As I mentioned in the previous video, so much of what's happening mentally, which of course we know are chemical reactions, neurotransmitters sending signals to our body that create how we feel emotionally, a lot of what's happening mentally has to do with these embedded subconscious records that are playing over and over. Now, how do you get down to that level where you embedded them, right? Because when we're young, we absorb them just like a sponge. And now that we're older, our mind's usually running in this sort of like fast beta pattern, really, really fast brain activity, right? Really frenetic, as opposed to the slower delta or alpha waves that allow us to absorb new information. This is one of the main reasons why affirmations, oh, I'm so healthy and strong, everything's gonna be okay, don't work. If you're in fast beta, your brain's already in a conclusion. It's already running a program. EFT meridian tapping gives a new signal to the amygdala that allows the brain to slow down into a new pattern and absorb new information. So we can literally delete the effect of those old toxic thoughts, memories, ideas, or beliefs and embed and implant healthier, more expansive, life-giving awareness, beliefs, thoughts, ideas, so that we get a major change in those subconscious records that are constantly playing. Now imagine the impact you could have for your patient to get some of that stuff out and even just neutralize it. Huge, huge impact on how they feel emotionally and physically. EFT meridian tapping also has a profound effect on how you're feeling emotionally, what the chemical responses are in your body, what's your chemical state. We've seen that our emotional state is directly linked to our physiologic function. The Institute of Heart Math has tons of studies for this, showing that when patients are in the state of anger, they have more heart rate irritability, more variability in the rate. When they're in the state of joy, there's not only decreased pain perception, but there's also restoration of harmony in the blood pressure, the heart rate, the respiration, and how these things are integrated. So our emotional state directly affects what's happening physically. And EFT meridian tapping allows us to release that trigger at the level of the amygdala that puts us into that emotional state, that discord cord. So I've seen people with severe anxiety, depression, anger issues be able to use this to very, very quickly change those patterns. It also works on the physical level. Now, even if we just think about the fascia and getting a release in that fascia, all of our muscles are wrapped up like saran wrap in the fascia. And so, you have the nervous system, the nerves are getting compressed. You have increased pain, you have increased waste product buildup because you don't have that relaxation. So the muscle can release that resistance, release the waste products and the tension. So patients with fibromyalgia, it's incredible how quickly I've seen them be able to release the physical tension through this fascial release with EFT meridian tapping. So definitely an immediate, tangible physical response directly. Now, I've mentioned in the previous video that our thoughts affect how we feel emotionally and our emotions affect what we're seeing physically. This is one of the biggest reasons why I've been able to see people heal all kinds of physical disease. Not just that they feel better, but that we see chemical changes, physical cellular changes, no longer having those lab results that show all the inflammation and reactivity to all these different allergens, for example, or no longer seeing a nodule on the thyroid or thyroid imbalance, that now that thyroid's healthy and it creates healthy thyroid hormone and the patient feels better. So the mental and emotional changes will create amazing freedom to allow the body to heal itself. And that's really the premise of mind-body medicine. I talked in the first video a lot about the main components, but the fact that we can support the body in healing itself is infinitely more powerful than anything we're doing in medicine that doesn't appreciate that. Like, let's just treat these physical things without the awareness of the whole. So I am going to support you more going further into how to use EFT meridian tapping. I'll make sure to send you some resources so you are aware of what it is if you've never been introduced to it before. It's just a gentle way of giving new information physically that sends a signal to your amygdala, to your brain, and it disrupts those fight or flight patterns that are triggering you or triggering your patient into that dis-ease, into that disharmony. So I will go more into this in the webinar for sure. Stay tuned for the webinar, and please send me your questions, comments. What do you think about this perspective? How might you see yourself applying this in practice? Or what questions do you have about, geez, how do I even begin to integrate this into what I'm doing? I've had surgeons begin to use this and have amazing, like a deeper connection with their patients and a deeper, really allowing their patients to heal because they're appreciating the whole picture and getting behind this mechanism, supporting their patients' self-healing. So it isn't a matter of either or. Well, I'm going to do this other thing, so I don't need to, integrate this into my practice. As I see it, the medicine of the future will be one that incorporates this whole perspective of what we now know clinically. We've seen in so many clinical studies that our mind and body are connected. We've seen that the body does have this innate healing capacity, and we've of course seen that the mental and emotional systems directly affect what's happening physically. So I look forward to supporting you further in integrating this in your practice for greater fulfillment for yourself and having meaning and purpose in what you're doing in medicine, and also for getting dramatically improved results for the people that you're serving. This is Dr. KIMDERAMO from the American Institute of Mind-Body Medicine and DRKIMD.com. Share this with people that you know who would be interested in this, because I'm excited about getting the word out and supporting as many people as possible. And stay tuned for the webinar. Be well, and I'll see you soon.